Hello everyone. Today we are going to discuss about plantar reflex. So we'll see what is the normal plantar reflex first.
Sir, basically we have to ask the patient to sleep and the patient should be in supine position and the legs to be extended. To check for plantar this thing, we have to stroke or give the stimulus from the lateral aspect of the sole, sir. And we have to move medially till the end of the second metatarsal.
Okay. So as explained by him, we are going to demonstrate it now. First we have to grip at the ankle joint so that we can prevent the withdrawal response. Then from the lateral aspect of the sole, we have to stroke here so that we can give a noxious stimulus. So from lateral aspect, we have to come towards medial side till the head of second metatarsal. We have to stop here. We will get the response. There are two important things when we are eliciting this reflex. We have to stop at second metatarsal head. We should not stimulate first one because stimulation of head of first metatarsal will lead to dorsiflexion of the great toe even in normal individuals. So to prevent that, we have to stop here. Second thing is, we will always give stroke on the lateral aspect, but not on the medial aspect because stimulation of medial aspect will lead to elicitation of the grasp reflex, not plantar reflex. That's why we should always give stimulus on the lateral aspect. So what is the normal response?
Normal response will be the flexion of all the toes, sometimes the plantar flexion of the ankles.
Okay. What is the root value for this reflex?
The root value for plantar reflex is S1.
Okay, we just now saw the normal reflex. What might be the other responses when we are doing plantar reflex?
Sir, the other response can be extensor plantar response. Extensor plantar response is also known as Babinski sign, and in Babinski sign has 5 components. The first thing is dorsiflexion of the great toe and fanning of all the other digits, and there will be flexion at the knee joint and flexion at the hip joint, along with contraction of the tensor fasciae latalis. This sign is usually seen in human lesions.
Right. So these are the components of Babinski sign. What might be the other responses during this reflex?
Sir, no response might be elicited. The no response may be elicited in various conditions. So I'll tell 3 conditions. One might be a 40 technique, and the second might be a thick sole, and third might be peripheral neuropathy.
Okay. So sometimes we will not get any response. That's what he is saying, no response. Mainly if the technique is faulty or when the sole is very thick or peripheral neuropathy, even we can consider myelopathy at the segment of S1. Any other responses you want to add on?
There might be a minimal response or withdrawal response, sir. So in minimal response means out of all 5 components in the Babinski sign, there is only the contraction of the tensor lata muscle. That will be considered as a minimal response. Withdrawal response is like there will be a withdrawal reflex for plantar reflex.
So there might be chances of other 2 responses like withdrawal seen in sensitive soles. That can be a normal finding. And one more he told is minimal response. Among 5 components of Babinski, if we get only contraction of tensor fasciae lata or even in normal plantar flexion response, if there is contraction of adductors, sartorius muscle, that is considered as minimal response. So it can be both normal as well as pathogenic. So we saw normal response, extensor response, withdrawal, minimal response and no response. And there is something called as equivocal response. So to understand that, whenever there is very few components of Babinski elicited, not all 5, but 1 or 2 or 3 like that, it is called as equivocal response. That is, this equivocal response is almost equal to extensor response. So the patient within few days might develop extensor response properly. That is first thing. When the injured leg gives no response at all, but the other normal leg gives flexor response, that is also considered as equivocal response. And sometimes we will see flexor response in both the legs, but the side which is injured, flexion will not be that evident as that of normal limb. So that discrepancy between the 2 limbs is also considered as equivocal response. So as we told, equivocal response might turn into extensor response within few days. So today's equivalent response might be extensor response for tomorrow. Sometimes when the UMN lesion is severe and very extensive, the reflex zone will be extended. So in such cases, some other spots we can utilize to elicit the same response, or some individuals will have sensitive sole, so will not be able to elicit the response properly. So in such individuals, we can choose other methods to elicit the same reflex. So we'll see that now. So can you tell any other method to elicit the same response?
Sir, we can do open aim method, sir. So in open aim method, we have to expose the leg of the patient. Then we have to stroke anterior medial aspect of the tibia with the finger or thumb and or with the knuckle of your finger, sir. We'll go from upward to downwards.
Okay. Can you just demonstrate that?
Yes. Anterior medial head of the tibia, we have to give the stroke, sir.
So we'll get the same response. Any other method to elicit the same reflex?
Sir, we have a Chaddock's method. In Chaddock's method, we stroke the lateral aspect of the foot below the lateral malleolus, and we'll expect the similar response, sir.
Can you demonstrate it? Okay, so this is Chadoc's method. Anything else?
So we can use the Gordon's method. In Gordon's method, it's done by squeezing the calf muscles and squeezing the Achilles tendon also.
Okay. Just demonstrate it once.
Yes.
So we can either squeeze calf muscles or Achilles tendon and we will get the same response. So these are some other methods to elicit the reflex. As I told, the reflex zone will be increased. Normally we will stimulate here, but in case of extensive injury in the UMN, there will be extension of the reflex zone. So stimulation of the tibia or the lateral aspect or calf muscles will also give the same result. All about plantar reflex. Thank you so much.